Hello, my name is Dr. Dewan S. Raja. Today I will discuss about multiple choice questions in neurology. Let's start. Question number 1. A 30-year-old woman present with a history of intermittent numbness and tingling in her arms and legs. She reports fatigue and occasional difficulty with coordination. The symptoms have been occurring on and off for the past 6 months. On neurological examination, there are no signs of weakness and the cranial nerves are intact. However, there is evidence of brisk reflexes and a positive Babinski sign. What diagnostic test or imaging should be most appropriate to confirm the diagnosis? We have choices: magnetic resonance imaging MRI of the brain and spinal cord, lumbar puncture for cerebrospinal fluid analysis, electromyography and nerve conduction studies, blood test to check for vitamin deficiencies, complete blood count and liver function test. So, 30-year-old woman presents with a history of intermittent numbness and tingling in her arms and legs. What is the correct answer? What diagnostic test or imaging would be most appropriate to confirm the diagnosis? Answer should be A. Magnetic resonance imaging of the brain and spinal cord. So answer is A. Question number 2. A 45-year-old man complains of sudden loss of vision in one eye. He reports pain in eye movement and has had visual disturbances over the past week. On examination, there is evidence of decreased visual acuity in the affected eye. Fundoscopic examination reveals swelling of the optic disc. Lumbar puncture for cerebrospinal fluid analysis reveals elevated immunoglobulins, mononuclear white blood cells and positive oligoclonal bands. The MRI shows periventricular plaques. What is your diagnosis? A. Guillain-Barré syndrome, B. Lyme disease, C. CNS lymphoma, D. multiple sclerosis, E. leukodystrophy. So what is the diagnosis? Here is the MRI. This is the periventricular plaque. Okay. So, and sudden loss of vision of one eye. What would be the diagnosis? Okay. Diagnosis should be what? GB, Lyme disease, CNS lymphoma, multiple sclerosis, leukodystrophy. Answer should be multiple sclerosis. D is the answer. Multiple sclerosis. Okay. D is the answer. Multiple sclerosis. Okay. Next to the next question. Question number 3. A 42-year-old man with secondary progressive multiple sclerosis, SPMS, experiences worsening neurological symptoms, including increased difficulty with mobility and coordination. The neurologist discusses the option of disease-modifying therapy specifically approved for secondary progressive multiple sclerosis. Which of the following medication is commonly used as a first-line disease-modifying therapy in relapsing remitting multiple sclerosis? A. Cyanocobalamin, B. Oral corticosteroids, C. Intravenous immunoglobulin, D. Methotrexate, E is the answer. Interferon beta 1A. This is the answer. Interferon beta 1A. Okay. Question number 4. A 25-year-old woman presents with numbness and tingling in her extremities. Neurological examination reveals decreased sensation and weakness. The patient is subsequently diagnosed with multiple sclerosis. What is the primary pathological process underlying demyelination in multiple sclerosis? Is it axonal degeneration? Is it inflammation? C. Neuronal apoptosis. D. Increased neurotransmission. E. Amyloidosis of CNS. What is the correct answer? We don't know the exact cause of multiple sclerosis, but we can understand the pathogenesis. So, what is the correct answer? Most possible answer. Answer should be B. Inflammation. B is the answer. Question number 4. B is the answer. Inflammation. Question number 5. A 45-year-old man is diagnosed with primary progressive multiple sclerosis, PPMS. He has been experiencing a gradual worsening of symptoms without distinct relapses. Which immune cells are prominently involved in the inflammatory response in these multiple sclerosis lesions? A. Natural killer cells. B. Eosinophil. D. Lymphocytes. B. Eosinophil. C. T lymphocyte. D. B lymphocyte. E. mast cells. So, what immune cells are prominently involved in the inflammatory response in this multiple sclerosis patient? Natural killer cells, eosinophils, T lymphocytes, B lymphocytes, mast cells. What is the correct answer? Correct answer is C. T lymphocytes. Okay. And that's all for today, and these are the answers. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.